first paying confirms, no known allergies, so that's good. Alright, today what I'm going to be doing is cleaning and redressing your wound. And we're going to get that old dressing off and put some new dressing on. Alright, on a scale of 1 to 10, how is your pain right now? Alright, it's about a 2, and that's good because I did pre-medicate you 30 minutes prior, and it seems like your pain level came down a whole lot, so that's really good. Alright, so I'm going to close the door, and we'll do a little hand hygiene. Alright, now I'm going to gather all my supplies. My red bag ready. And I'm tearing out 4 pieces of tape. Alright, and then after I got my tape ready, make sure I have my normal saline, my red bag. I would raise the bed to above waist height, and then I'm gonna go ahead and cup my red bag, and I'm going to place it right here. I'm actually going to take the red bag so it won't move. Alright, so after I have that ready, my cuffed red bag, I'm going to put on gloves, and then we can get started, okay? Alright, now I'm going to drape the patient so I can see his wound. Alright, now you're going to feel me take off your old dressing. And on the dressing, I would note the color, the odor, and the amount of drainage on the dressing. And also on this dressing, I would note the color, odor, and amount of drainage on the dressing. And as for the actual wound, I would note the color of the wound bed, the wound edges, the wound closure, and I will also note any presence of drains if present. Alright, and so after I've done that and I've discarded my dressing, then I'll take off my gloves. And I'll discard those, and I'll do some hand hygiene. Alright, and then I'm gonna prepare my sterile fill. So I'm gonna open it out and away from me. Alright. And after I've prepared my sterile fill, then I'm gonna pull this down a little bit so I have some space. Alright, and I'm going to take out my sterile gloves. Make sure to touch the outer edge. Alright, and now I'm gonna put on my sterile gloves. And I'll be sure not to touch the outer part, just the inner cuff. As soon as I get my gloves on correctly. Eventually. And assuming I had them on correctly. Alright, then I will place this glove in the outer cuff. And I will put on my other gloves. Okay. Alright, and now I'm ready to clean the room. Okay, so the first thing I'm going to do is I'm going to clean your wound, okay? So, and before I put on my sterile gloves, I would have poured my normal saline. So, I'm going to go ahead and do that now. Without splashing it. And like I said, I would have done this before I put on my sterile gloves. Okay, now I'm going to take a 4x4 and I'm going to moisten it and dip it into my normal saline, and I'm going to wipe the inside of the wound. I'm going to throw it away. I'm going to get another one. Alright, and I'm going to wipe the outside of the wound. Now after I've done that, I'm going to take a Q-tip and I'm going to moisten it. And the inside of this is sterile, so I'm going to pick it up on the inside and I'm going to throw it away so I can get to my measuring. Alright, I will moisten this, and first I would measure
I had to go back and do that. So even though it's already set up, just move it. Or I'm going to set up the equipment.
Okay, and it's about a little bit more. Okay, and now I'm going to measure my width. Alright, then I will measure that. Alright, and now I'm going to measure the depth. Now I'm gonna throw this away. Okay, and the next thing, oh, and while I was measuring, I would make sure to check for any tunneling in the wound, and I would note the location of the tunneling. Alright, the next thing that I'm going to do is I'm going to get a 4x4 and kind of fluff it out, and maybe actually get 2. So we'll have enough. Alright, I'm gonna moisten the 4x4s and squeeze any excess moisture out. Alright, and I'm going to take my other Q-tip and I'm going to pack the wound lightly using a Q-tip. Alright, then I would throw this away in my red bag. Alright, and now I will take a dry 4x4 and place it over the wound. Then I'm gonna get my ABD pad and I would place this over the wound. And then I would take off my gloves. And I will get my tape that I have for the pads. And then after I've done that, I would redrape my patient, and I would lower his bed back down, raise the side rail if needed, and here's your call light. Call us if you need anything, okay? If your wound if you start to feel any pain around your wound, please call us, okay? Alright, and then after I've done that, I will put on more gloves. be sure to get my red bag out of the room, and then clean up any of my supplies that I had. And I would also get this out of the patient's room and just make sure I have everything cleaned up. And then I would discard my gloves and do some hand hygiene, and then I would document. And I would document once again the color, odor, and amount of drainage on the dressing. I would also note the color of the wound bed, note the wound edges, the wound closure, and any drainage if present. I would also note the measurements that I took when measuring the wound, and I would note the wound cleansing and irrigation, the type of dressing I used, and how the patient tolerated the redressing of his wound.